Most traumatic brain injury related emergency departments are from everyday products and activities. Here with more, Dr. Richard Chafu is here with this new study. Good morning and thank you for being here.
Good to be here.
A lot of kiddos go to the hospital for this.
Yes, many, and unfortunately, you know, there was a study done between 2010 and 2013, Shawley, and there were 4.1 million traumatic brain injury visits to emergency rooms in the United States during that 4-year period. So it's a significant health problem.
When we think of traumatic brain injuries with the kids, I usually think sports, football, and I've tried to keep all my kiddos out of that stuff.
Yes, but it's not that. As you say, it's the most common things we saw from this study. For example, this was furnishings, furniture, of course sports equipment, but in the younger children, the children up to 4 to 5 years of age, it's really activities in their home environment, things that we have around the home, common consumer items.
Let's go through some of these as parents are watching right now. You have the floors.
The floors, which we wouldn't think about, the ceilings, the walls, stairs, beds. And people have also noticed that the number 5 cause is actually using these car seats inappropriately, or infant carry seats, where some of the parents would bring them in and have them on a table or on a chair, and then that obviously could topple over and cause an accident.
Oh, that is an interest. We don't even think about that. I have that little baby right now. He doesn't move around a lot, so when I want to cook, I think I can just put him up here, but that's a no-no.
It can be a no-no because, again, they're not designed to be used in that kind of situation.
Okay, so what was the study, what was it saying?
So basically the study was saying that the most important thing that we can do is to, number one, be aware of traumatic brain injury as a significant health risk, and then common things we can do around our home to keep our home safe. For example, we mentioned earlier on about the floor. The reason that was because of these small area rugs, throw rugs on a slippery surface, either a wood or a tile, they can slip it. You want to improve the lighting, obviously, because if we're not seeing well, we're more likely to trip. Remembering those safety gates that are very important to use in stairwells. And if we're using stairwells, we're using the banisters, make sure if they're sharp, we want to have them padded. Those are some very simple things, and obviously we want to be careful about railings for beds. We want to have children at the right age in the right type of bed environment.
Yeah, that's another one, because my little girl now is sleeping with and I think about her toppling over, so making sure those railings are up.
Exactly, very important.
Okay, in other news, I want to talk about this because we talked about this on our morning show. 8 teens just hospitalized, this vaping, and I think the misconception is that it's safe. Everybody was not cigarettes.
Shawley, you're right. It's anything but safe. And the problem is that in these unfortunate teens, we're not sure really what they were vaping, whether it was tobacco or whether it was weed or a combination of those. But the problem is that there are about 2 million of our youth in the United States that are using vaping products. And we do know that daily use of these devices increases our risk for a heart attack, doubling our risk of a heart attack. The problem, Shawley, is that these devices are battery powered, they have a large concentration of nicotine, and they can use them on a continuous basis. And there are no long-term studies that really have looked at what are the health impacts of these devices on our kids long-term in terms of inhaling these chemicals, nicotine, etc. We just haven't had them around long enough to know the health detriments.
There's no long-term study because they're fairly new, but still you have 8 teens that were hospitalized because of severe damage to the lungs. So if you're seeing this type of reaction now, I can't even imagine what it would be like long-term.
Exactly, and we do have those long-term longitudinal studies from tobacco use from back in the 50s. So we've got decades of knowing that nicotine inhalation, these other chemicals are not helpful and are actually very injurious to your health.
Are there additional issues that complicate all of this?
So the issues that complicate this are the fact that it's easy for kids to get these off the web. We know it's illegal for children under the age of 18, but there are obviously ways around those block or parental controls. So it's being aware of what your children are doing and educating them as to the health hazards and risks. They're really not cool. The potential risks are significant.
Dr. Chafu, sometimes I look at my little ones and I'm like, stay little, because I don't know if I want to deal with all these.
Exactly.
It's easier when they're little, right?
So much easier.
Yeah. All right, thank you for being here.
Thank you,
All right, 9:19, let's get you over to